I'm Dr. Charles Daknis. I'm an interventional pain management physician here at Spine and Pain Centers of New Jersey and New York. I did my fellowship training in interventional pain management at Harvard University's Brigham and Women's Hospital in Boston. And prior to that, I was at Albany Medical Center for anesthesia and neurosurgery. Welcome to my video series on interventional pain management technique. I hope over the course of this series, we get to understand pain management techniques and how they can help to restore your function and restore your quality of life. I look forward to seeing you and working with you. Hello, today we'll be talking about facet joint pain. What is a facet joint? Our spines are an interconnected group of bones that are cushioned by our intervertebral discs and connected to each other by joints. These joints are known commonly as facet joints, or technically as zygapophyseal joints or Z joints. Just like any other joint in the body, these joints can become damaged by arthritis or injured by sprain and trauma. Just like you can sprain your ankle in a sports injury, you can sprain your facet joints in an auto accident or an injury. The problem is that the joints can become chronically painful if not treated properly. Now, people that suffer from facet joint pain of the neck will usually complain of neck pain and usually headaches. Headaches will usually be on one side of the head, and pain may radiate from the neck to the back of the head and possibly over the top of the head to the eye. Now, these headaches will be worse with stress and with looking upward. A person that has this problem may have significant loss of range of motion of their neck. And people that suffer from facet joint pain in the mid-back or thoracic spine will complain of mid-back pain, usually between their shoulder blades, and it really won't radiate to the chest wall. And this is often seen in laborers or individuals that carry heavy packs, like soldiers. Facet joint pain in the low back will present with low back pain, and also some pain will radiate into the upper parts of the back of the thigh. Pain's usually worse in the mornings and with extension of the back, in other words, bending backwards. Evaluation of the joints is performed by anesthetizing the nerve supply to the joint. Your doctor may discuss doing a procedure called a facet nerve block or medial branch block. This is where a small amount of local anesthetic is injected under X-ray guidance onto the nerve supply to the joint in question. Now, your doctor may treat more than one joint at a time, and after your doctor places local anesthetic on the nerve supply to the joint, you will need to keep what's called a pain diary. And it's important to keep the diary rating your pain between 0 from no pain to 10 being the worst pain imaginable. If the facet joint is the source of your pain should get better for the duration of the local anesthetic. And this can be anywhere between 4 to 12 hours. Now, many factors can affect the degree of muscle pain as a result of facet joint problems. And this may result in less than 75% reduction in your pain. And stress and anxiety can make this problem worse. If anxiety is a big problem for you, please discuss this with your doctor prior to the procedure. If the results are not optimal on the first try, your doctor may recommend a second facet nerve block. If your pain does respond temporarily to the block, then you may be a good candidate for a technique called a radiofrequency rhizotomy. This topic is covered under a separate video. Well, so how is this technique done? This procedure is done as an outpatient, so you can go home the same day, and is usually done in a surgery center or office setting with, as I've said, X-ray guidance. You are assisted to lie down on your stomach, and you may be sedated if it's indicated. Your vital signs will be monitored, and a small amount of local anesthetic will then be used to numb the skin. Then, a small needle will be used to access the area where the facet joint nerves are. Once the needles are properly positioned, a small amount of local anesthetic is delivered, and then the needles are removed. This procedure should take about 10 minutes and is very minimally invasive. Once the procedure is finished, you go to the recovery area and the staff will make sure that you have a pain diary to fill out and will make sure that you're doing well and have no questions. Now, you should see your doctor within 1 week from the block to discuss your results and your diary. What are the risks from this procedure? Well, the procedure is quite safe. It does require a needle to be placed through the skin, so infection is always a concern. Risk of damage to the surrounding tissues or organs or nerves is theoretically possible, but very unlikely. As with all the topics of this video series, this information contained here is for general educational value and your convenience, and should not be considered a replacement for and an evaluation by your doctor. Thanks very much. I look forward to seeing you in the office.